Hello, my name is Dr. Heather Prendergast, and I am one of the principal investigators for the AHEAD2 research study. You are being asked to be a subject in a research study. The purpose of this video is to tell you about the study. The study is called a Hypertension Emergency Department Intervention Aimed at Decreasing Disparities, AHEAD2. The purpose of this study is to determine the effectiveness of a hypertension risk assessment referral program initiated from the emergency department on blood pressure control and follow-up rates with a primary care provider. You are eligible for this study because you are a patient in the emergency department with elevated blood pressure. If you decide to participate, you will be randomly assigned to one of 3 groups for the study protocol. Depending upon your group assignment, you may receive regular emergency department care procedures of written discharge instructions and a referral to your primary care doctor. Or, depending on what group you are randomly assigned to, you may be asked to complete brief surveys, have an ultrasound done of your heart, have a urine sample taken, watch a short video on hypertension, or attend a follow-up visit to a hypertension clinic. You will receive a home blood pressure monitoring kit so that you can take and record your blood pressure yourself at home. We will ask you to return to the University of Illinois Emergency Department after 24 to 48 hours if you are in Group 2. All other groups will be asked to return at 6 months and a year to repeat the assessments performed today. You will also receive phone calls from study staff to verify your contact information in 3 months and 9 months. There will be up to 675 subjects with elevated blood pressures at the time of discharge from the University of Illinois Emergency Department enrolled in this study. Your participation in this study is voluntary. Your decision whether or not to participate will not affect your current or future relationship with the university. The care you receive in the emergency room will be the same whether or not you participate. If you decide to participate, you are free to withdraw at any time without affecting that relationship. We will also need to record your name and medical record number in order to get information from your medical record about your health, any recent medication, or illnesses. By signing the consent form, you are allowing access to your medical record and the disclosure of your health information to myself, Dr. Heather Prendergast, my research team, and the sponsor of this research. This permission to access your medical records has no expiration date, but you may withdraw your permission for the use of your health information for this study at any time, and information on how to do so is on the paper consent form given to you. Potential risks include the loss of patient confidentiality. However, all study-related assessments will be kept in a password-protected, secured location and will only be accessible by key study personnel. Potential benefits include improvement in blood pressure and establishment of ongoing primary care. Knowledge may be gained from this research that may help others in the future with uncontrolled hypertension in the emergency department. Subjects will be compensated for in-person follow-up study visits at 6 months and at 1 year with $50 cash after each study visit, as well as either a parking pass or CTA pass depending on how you get to the emergency department. Now that you have heard about the procedures, risks, and benefits of the study, you may have questions. If you do, you can ask the member of the research team at the end of this video. If you agree to participate in this research, you will be asked to sign the consent form. If you later have questions about the study, the contact information of the researchers is listed on your consent form, which you can take home with you. Thank you so much for your time.